My name is Charlie Damon. I'm the Care Australia Pacific Humanitarian Capacity Coordinator.
My name is Kolosa Matembalabu. I'm the Humanitarian Preparedness and Response Coordinator and Preparedness Coordinator for Live and Learn Environmental Education.
I'm Isoa Vakarewa. I'm a project manager with Live and Learn Environment Education.
My name is Litiana Ndimaupa, and I'm the WASH coordinator for Live and Learn Fiji.
My name's Adash, and I'm the program manager of Save the Children Fiji.
Everyone, my name's Charlotte. I work for Save the Children in New Zealand, and I manage some of their programs in the Pacific and in Asia as well.
So Cyclone Yasa hit Fiji in December. Due to the size and scale of the cyclone, we knew that we would need to access some funds rapidly to enable our partners in country to respond. And we've had great experience with the Start Fund before in terms of its rapid response to requests, which enabled us to do a very reactive emergency response action.
We knew that Start Fund was going to support the affected population, immediately for that period. Also, I think Start Fund was going to complement other funding mechanisms, and because of its quick turnaround time, we will be able to really reach out to these affected populations on time.
And because it happened in the sort of run up to Christmas and everyone going on leave, it was quite difficult to get donor interest. And I think also after a year of COVID, there was just a little bit of, I guess I would call it donor fatigue. So that was kind of the reason really for approaching the Start Fund, because we knew that if we were successful in getting funding through Start, that it would be on the ground quickly.
The timeliness. Basically, we did a proposal, and within a few days, we were able to conduct our response activities in the field. And that is one of the best things I found out with the Start Fund is immediate action.
A lot of the other funding streams that we can access are more around recovery than immediate response.
Just a few days after the cyclone, we were notified within 48 hours that we had the funding. So the team was quick to mobilize and get into the affected areas to really start with our response work.
In terms of getting help to the people who need it quickly, this is the best mechanism that we have, basically.
So the first partnership is the Care Australia and Live and Learn. Live and Learn work with the provincial government partners, and then through their community-based work, places them in good stead to enable responsive humanitarian action.
IKEA have a lot of access to consultants in Fiji, across the regions, and this partnership has access to highly skilled staff and advisors that that are usually called upon for immediate sets capacity. And for us as a local organizations, having this surge support during disaster response, it really helps us getting the strength, the expertise, the skills that we our partner have, merging it with Live and Learn's extensive network and community-based experience in Fiji. These two really works together.
We partnered with Habitat for Humanity. So this is a long outstanding partner for Save the Children Fiji. And while Save focused on delivering hygiene kits, providing WASH training and guidance to the communities, continuous education for students and child protection, Habitat actually focused on providing safe spaces for individuals to take showers in, especially focusing on women as well, by setting up temporary shelter kits and also looking at the WASH facilities in homes. So that was their focus, shelter and WASH. And that's how we complemented each other.
When we received our Start Fund, we were able to provide relief to the most affected areas with distribution of WASH and hygiene kits. And this was complemented with hygiene promotion, specifically to conduct awareness sessions on prevention of communicable diseases that are usually common after a disaster.
Habitat for Humanity have an intervention that they call Build Back Better. So they do a lot of community sensitization around how you can, rebuild your home so that it can withstand the next tropical cyclone, because obviously Fiji gets tropical cyclones most years. We also did some stuff with child-friendly spaces in shelters. So making sure that children who were affected by the cyclone had psychosocial support, and made sure that the people who were involved in running the shelters had safeguarding training. And then finally, we distributed some back to school kits. So children whose homes were destroyed, who had their study materials destroyed, they were able to go back to school as soon as the schools were able to open, with fresh packs and fresh stationery and other stuff to get started back at school.
We were able to, for the first time, also mobilize assessment as part of the initial distribution of wash kits. In the past, we would rely on the assessments that's done by government. But this time around, it gave us an opportunity to mobilize a team that also included not only the Live and Learn team, but also partners that we were able to target: people living with disabilities, people of SOGIESC, through the assessments that we were able to mobilize as well, which gave us an opportunity to really look at the issues on the ground soon after the cyclone, which then informed our mobilization of response programs that happened a little later on.
One of the greatest impacts the Start Fund actually had is the timeliness of the interventions. And that actually helped communities actually recover quicker. Basically, there were no major disease outbreaks. And then when we provided child-friendly space kits, children were actually protected. And this actually helped parents and other communities focus on rebuilding their lives.
We have had experience with other donor partners, where they come on board 1 month, 2 months, sometimes even 6 months after a disaster strike. So straight after disaster, timing is very important in order for us to reduce the risk of people being affected.